We're excited that you're gonna have the MyEllevate procedure at New Life Cosmetic Surgery. It's a great procedure. Super thankful that the Beverly Hills facial plastic surgeon, Dr. Mueller, came out with this a few years ago. Things to understand with MyEllevate is this. Number one is that for the first 10 days, you should not be looking downwards. And why is that? Well, when we put that suture suspension along the cervical mental angle here, and you're looking down in the first 10 days, the skin will bunch up. And I've seen that happen, and you don't want that. So for the first 10 days, it's absolutely important to not be looking down at your phone. And so we give you some things to prevent you from looking down, and we'll give you basically a neck brace. That neck brace helps prevent you from looking down. You need to wear it for the first 48 hours, pretty much nonstop. You can take it off after you see us on post-op day one, just to be eating and maybe drinking some, because it can be a little bit uncomfortable when you're eating and drinking to wear that brace. But any other time after that, you need to be wearing that face garment neck brace. The second thing that we do is at nighttime, we'll give you a collar to wear, a little soft collar, and that also helps prevent you from looking down at nighttime too. Some people don't need that. The face garment alone prevents them from looking down, but we often will give that little collar to help you from looking down at nighttime. After 10 days, you're free. You can look down some. Don't have to be as strict on that. But again, I think it's good, at least in the first 6 weeks, not to spend a ton of time looking down at your phone. Some people have jobs though where they have to look down, and I totally get it. And in those cases, you gotta do what you gotta do. But that's one of the very important things with the MyEllevate procedure is to not look down. The next thing to understand is from a result standpoint, you're gonna have some skin pleating often, because what it's doing is we're not removing any skin. That's the difference between this procedure and a neck lift. A neck lift is a lot longer recovery, and they're removing skin. Because we're not removing skin, but we're just tightening the skin, you can get what's called pleating along, and it's where the little skin bunches up in certain areas along your neck. And that often occurs very frequently. And if that does occur, it's nothing to worry about. Those little pleats generally go away within 3 to 7 days. And lastly, you can have some bruising, completely normal, or some pain behind the ear where the suture is kind of suspended up to. If you have some pain or tingling, or your ear feels a little numb, all common things that do resolve.